I wanted to just mention a couple of the real big pluses that participation in the DPBRN has brought to me in my practice. And one of the really big pluses that I think about each day and I enjoy just about every day is the collegiality and the interaction of fellow DPBRNers. We started several years ago when we first started participating in the DPBRN and began emailing different clinical questions as well as personal and life questions. And it brought us closer to several of our colleagues, and I depend routinely on the collegiality and the interaction with my DPBRN friends. That's more than just being another dentist and having another dental friend. It's having an ally and also a source of clinical questions and recommendations. Another big plus that participation in the DPBRN has given me is better communication with my patients and discussing different clinical questions and clinical ideas that we want to investigate. You communicate these back and forth among each other, as well as aspects and questions you may want to answer that your patients bring to you. So it's allowed me to focus quite a bit on questions my patients have and what's important to them. And in doing so, I'm able to answer those questions through DPBRN research. Another good aspect of participation is it gives you very reliable and very relevant clinical questions that we've answered with our research. We as dental practitioners decide which clinical questions that we would like to answer. And also we help implement and produce the research, which is regulated and passed on, but then we still have a real input into how that research is implemented in our offices and how it's conducted. So we have the really sort of a dream thought of answering questions that we care about and doing it in our practices and with our colleagues. So it's the questions we care about as well as the reliability that it's been done by us.